most commonly identified sexual problem among males, is known as erectile dysfunction or impotency. Impotency is defined as trouble getting or keeping an erection that's firm enough for sex. It is not rare to have this issue even in young men. But if it is happening more often, by affecting his sexual life, this should be treated. There can be many reasons to cause this condition. Some of them are high levels of stress and anxiety, tiredness, issues in blood flow and nerve damages in penis. Sometimes this can be a previous sign of a dangerous heart disease, so it is always better to talk this with your doctor. Now let's see how erections work. When a person is sexually aroused, nerves start to release chemicals which increases the blood flow to penis. As a result of this, blood flows into two special chambers inside penis which is made from spongy tissues called corpus cavernosum. After trapping blood in these tissues, penis gets hard and erected. After having the orgasm, trapped blood will goes back to blood circulation system with the contraction of spongy tissues. This causes the penis come into flaccid state again. When person is not aroused, his penis is in this soft state. There are some risk factors for erectile dysfunction. They are having high cholesterol amounts in blood, diabetes, smoking, using drugs and alcohol, lack of exercises, being over age 50. There are some other sexual disorders related to erectile dysfunction like delayed ejaculation, premature ejaculation and inability to achieve an orgasm. Urologists will perform few tests to identify the exact reason for the problem. Those can be ultrasound scan. It is used to examine the issues in blood vessels and blood flow to the penis. Injection test. A drug is injected into penis to simulate an erection. This allows doctors to examine the erection period and firmness of penis. Urine tests. Urine can be used to check the diabetes conditions. Blood tests. Blood tests are used to check sugar and cholesterol levels in blood. And also hormonal levels also can be checked through this. Common treatments for erectile dysfunction. Oral drugs. These drugs are called PDE5 inhibitors, which increases the blood flow to penis. Viagra is an example for this. Men should use these pills 1 hour before sex. Testosterone replacement therapy. This treatment is used to increase testosterone levels in blood by curing erectile dysfunction. It will use injections, skin patches or creams to do this. Vacuum pumps. In this therapy, a plastic or glass tube will use to cover the penis and suck out the air inside it. This will cause the spongy tissues in penis to absorb blood and get a hard erection. Inflatable implants. In here, fluid-filled cylinders are placed inside penis lengthwise, and a pump is used to inflate these tubes when needed. This method makes normal looking for both partners, and does not make any difference in feeling or in orgasm. However, there are some natural ways to keep a good sexual health. Some of them are doing exercises daily to maintain an active body and relaxed mind. Performing Kegel exercises which strengthen your pelvic floor muscles. Yoga will reduce stress and anxiety of your mind. Having good nutritious foods like milk, eggs, nuts, whole grains, vegetables, and fruits. Avoid smoking and taking excessive amounts of liquor. However, you should not be worried if you are having this health condition, because there are successful medications for this. Seek an experienced urologist and talk with him if you have any trouble. Please subscribe and click the bell icon for upcoming videos. Thanks for watching.